Welcome to Peds Doc Talk TV. I am Dr. Mona, a board-certified pediatrician and mom to a toddler, and we are talking all about coughs and colds today. Why they're annoying, why they happen, some remedies for your child by age, including some over-the-counter medicines, as well as when to be concerned about coughs and colds in your kid. Make sure before we continue, you hit that subscribe button because that's how you stay up to date on all of my Peds Doc Talk TV content. And here we go. So just a couple disclaimers before we continue. Make sure if you are concerned about the diagnosis of your child, you speak to your child's clinician. I'm going to be going over coughs as it relates to the common cold. So if your child has a cough and it's from asthma or allergies, I would want you to speak to your child's clinician to make sure you're getting the proper management. If your child is an asthmatic, as I go through some of the remedies, I want you to make sure you clear it with your child's clinician. Some of the remedies may not be recommended in children with asthma. Also, I'll be going over some over-the-counter remedies. So as a disclaimer, none of this is sponsored by those brands. These are just products that I've seen used by many of my families in my office, and I'm using it as an educational piece so you can decide what's best for your child. So I really wanted to do this video because I get a lot of families coming into my office almost feeling like we as pediatricians are holding out on them. Doctor, I want something to be done for my child's cough. There must be something you can prescribe. Or they stare at me blankly and say, hey, what are you going to prescribe for my child's cough, after I give them my spiel and my home remedies and pretty much what I'm doing in this video. The reality is there are not a lot of prescription medicines for coughs. Sometimes your child may need an antibiotic for something that is more like a pneumonia or a bacterial process. Other times though, your child will not need any prescriptions. Some of our asthmatic patients may need some nebulizers or albuterol prescriptions, but it's important to know that not every cough and cold needs a prescription. This can be really hard for a lot of families because they want something to be done. We want a quick fix, but unfortunately that's not how the human body works. As you go through this video, you're going to learn so much more about cough and cold, maybe more than you really wanted to know, but I think it's important so you understand the remedies that are best to attack the cough at its core. Before we get into the remedies, I think it's important to know, well, why do we cough? I get it. Coughs are really annoying. I hate when I have a cough. I hate when my son has a cough. They're not fun, but in many ways, they're a necessary thing to help protect our lungs. So in our body, we have cough receptors, and cough receptors help keep things out of the lungs. So if mucus hits it, if an irritant such as smoke hits that, you're going to start coughing because this is our body's way of protecting itself. Now, of course, some coughs are not protective and they are concerning, which I'll get into. But when you start to understand that coughs are not bad, maybe you'll embrace it and maybe you'll focus more on the treatments to help alleviate the discomfort versus trying to get it to go away as quickly as possible, because that may just need some time. So another common question I get asked is, why is it worse at nighttime? Well, as parents, everything seems to be worse at nighttime, right? We're all trying to get some sleep, and this is what it will feel like. And it makes sense from a physiological standpoint. When we're laying down, all of that mucus from a cold, for example, is going to pool into the back of our throat, which is where one of our cough receptors are. So when you are laying down, all of a sudden you feel like you need to cough because your body is saying, hey, there's something that's trying to get down into my lungs. So when we talk about cough and cold remedies, we're talking about ways to basically help reduce the mucus, alleviate that irritation at those cough receptors as well. So now we're going to go over remedies. First, I want to talk about your child who's under 1 year of age. Unfortunately, under 1 year of age, there are not a lot of medicines over the counter, and that's okay. Our goal here is to keep them as comfortable as possible. Again, these are not sponsored. Saline is something that I really want you all to get into your home. Saline is something that you can put into their nose to alleviate that congestion. Remember, they are not good at blowing their nose yet, which is understandable. They're babies and a lot of even toddlers can't do that. So what saline is going to do, saline is going to help alleviate that congestion. Sometimes you'll just need to squirt it in their nose and that'll help alleviate some of that mucus. Other times you may need to follow it up with the suction. This is the nasal Frida. Some people are terrified of it. You don't have to use the nasal Frida. With the nasal Frida, you're putting one end in here, one end in the nostril, and this is after using the saline to help suck out the mucus. Yes, you are sucking it out. There is a valve here to prevent the mucus to go into your mouth. I know some people think it's weird, but it does work. Another option is using the bulb suction, which is something that you probably got at the hospital. So you have options. If just say you put the saline in and nothing is really happening, you can use the bulb suction or use the nasal frida to help alleviate that mucus. So when do you have to use saline and suctioning? My advice is use the saline as often as you feel like it's beneficial. In terms of suctioning, I am not a big over-suctioning fan. The reality is the suction can be really irritating to the nasal passages, and it's like trying to drain a swimming pool. The mucus is going to still come and still pool because it's caused by usually a virus. But when you do want to suction is usually before a bottle feeding or before a breastfeeding session, because if they're very congested, they may not want to latch to the bottle or the breast as much. Or if your child is going to be eating, or before bedtime, you can do a suctioning. I don't need you to do it on the hour every couple hours. Use it as needed and be reserved because you don't want to really irritate their nose. Another example would be if they wake up from sleep super congested, you can obviously do a nasal saline and suction it out if obviously the nasal saline doesn't help. The next thing I like for under one or even over one is baby chest rub. There's a lot of disagreement or controversy about chest rubs. Now remember, there are two types of chest rubs. There are the ones for 2 and older, which is what you may use if you like that, and then there's ones for babies. The ones for babies is what I'm recommending. I do not recommend the one for adults. The reason is it contains camphor and menthol, which are really strong for the baby or infant airways. So over 2, you can use the adult one if you like, but under 2, I like to keep it with the baby version. Personally, I think the baby version is fine as long as you want to do it because it's the eucalyptus that I think is really helpful. Now, this, for example, is available 3 months plus. I know Zarbee's does carry a 2 months plus. These are options for you to use. You can always clear it with your pediatrician, especially if your child has sensitive skin, if you're unsure. So when you're using this, you can put it on the chest and on the back, use it before bedtime or nap time. This is what we use for Ryan when he has a cold. I do really like it. It's also what I use for myself, the adult version. So it's something to consider. Remember, if your child does have sensitive skin, maybe test a small area before you put it all over their chest and back. So the next thing is a humidifier. You'll hear people say, oh, a humidifier really doesn't help, or it really does. That's why my opinion is that if it helps you and your child, then go ahead and use it. Cool mist is what I would recommend. You want to make sure that you also clean out the filter so that there's no mold growing. Now, the one thing I will say, and like I said earlier, if your child is an asthmatic, sometimes a humidifier can make the asthma a little bit worse. It has a lot to do with dust mites and other allergens that can be exposed in the airways. So clear it with your pediatrician. But if you like the humidifier, what it can do is help moisten the air. And when your air is moistened, that means less irritation and less triggers for those cough receptors. So kind of what I was describing with nighttime, a humidifier can be something that you can put into the bedroom in case your child is irritated at night by that cough. So the next thing are steam showers. So if you've ever been sick with a cold and you take a hot shower, all that steam makes your airway feel more open. All of a sudden you feel not congested. That's kind of how steam showers work for children and babies and toddlers. So how you want to do a steam shower, you're going to close the bathroom door, turn on the water in the shower to as hot as it can get. When you close that door, steam is going to be created in that bathroom. You are going to bring your child in and hold them for 10 to 15 minutes max. You don't want to do more than that because you don't want them to overheat, and you stand in there with them. You can bounce around, you can listen to music, whatever is comfortable for you depending on the time of day. What that's going to do is just help alleviate some of that congestion. And again, similar to a humidifier, if this helps, I want you to use it. But if it doesn't, I don't want you to keep doing it. It's just an option at your disposal. The next thing for under one is baby Zarbee's. And again, this is not sponsored. This is just something I commonly see used. Baby Zarbee's is okay for 3 months plus. It is an option. I personally use this as a last resort. I like going through the saline, the suctioning if you need it, the humidifier, the baby Vicks or baby chest rub. Those are my things that I like to use more. Now, this is an okay option. It does not contain honey, which is why I'm okay with it. It contains agave, which is a form of honey, but does not carry the risk of botulism in our children younger than 1. So this is an option for you if it's something that you want over the counter. What you also want to make sure is that your child is hydrated. hydrated in the way that they are meant to be hydrated. So if your child is breastfed or formula fed, you're going to be giving them breast milk or formula. If they're not taking that, you want to make sure that you speak to your child's clinician to determine if they need something like Pedialyte. It's important that if your child's dehydrated with a cold, that they get medical attention. So now when we talk about remedies for over 1 year of age, remember you can use a lot of the remedies that I mentioned under 1, but you can now also add my favorite, which is honey. You'll probably hear your child's clinician often talk about the benefits of honey. It is nature's antimicrobial and nature's anti-inflammatory. It's a great cough medicine. It is also great because it's very viscous, it's thick, so it can coat the throat. So we talk about those cough triggers. If you give a teaspoon every night for your child who's over 1, it can help coat the throat. And also, like I said, it can really help alleviate some of that inflammation and help fight that virus process that's going on. Another question I get is, well, why for 1 whole year I'm not allowed to give my child honey and then all of a sudden they turn 1 and I can start giving them honey? The age of 1 is just set as a ballpark. It's a recommendation given that by that point we expect their digestive system to be more mature. By then they've been exposed to different foods, their gut bacteria has developed. We are concerned about giving little babies honey because their immature gut may not be able to weed out a spore called botulism toxin. It's a type of toxin that can live in honey. So we don't want to take that risk. It doesn't mean that if you give your infant honey that they're automatically going to get this, but in our opinion, why take the chance? So we set the age of 1 as just a ballpark of saying, hey, this is when the digestive system of the infant is most mature, they've been exposed to food, and this is when we see it's safe. It is safe to give it after 1 year of age. So there was actually a study comparing honey with dextromethorphan, which is a common ingredient in over-the-counter cough syrups for children. And the children who received honey actually reported better night's sleep, shorter durations of their cold, and improved symptoms. So I love honey for my patients. I love it for my own child who's over 1. I love it for myself. My favorite remedy for over 1 is turmeric milk. If you follow me on Pete's Doc Talk on Instagram, you know how much I love turmeric milk for coughs and colds. It's what I take when I'm sick. I also give it to my son who is over 1 year of age. Turmeric milk is a combination of various spices, and all of these spices individually are really good as an anti-inflammatory and antimicrobial. So turmeric, as we know, is a very common spice used in Indian cooking, and it's really great for inflammation, as is black pepper, as is cayenne pepper, and honey. So here's my recipe for turmeric milk. The reason why I love it so much is that it helps the inflammation. And remember, when we're sick with a cold, we have inflammation. Mucus causes our airway, throat, everything to be inflamed. There are a lot of over-the-counter remedies for your child who's over 1 to 2 years of age. A lot of these are homeopathic remedies. I personally don't always recommend it because I'm such a big fan of honey and because I'm such a big fan of turmeric milk. But you can always speak to your pediatrician if you're unsure about the ingredients. Remember, when it comes to these products, they are not regulated by the FDA. So these companies are putting these products out there and we're trusting them for their integrity and their efficacy. So now if your child is over 4, you're gonna have some options for cough and cold medicines if you don't wanna go the honey route, the turmeric route, and everything else I said already. Remember, I encourage you to do a lot of those principles that I mentioned already. If your child is not able to blow their nose, using saline, using the vapor rub, using humidifier if needed, and using honey and turmeric milk. But I wanna go over the 3 major components in cough and cold medicines in the market in the United States. This actually might be helpful for you too when you're going for your cough and cold and looking for something over the counter. So the first one we're gonna go over is dextromethorphan. Try saying that 3 times fast. So dextromethorphan is a component in something like Delsum. Again, this is not sponsored, just education. Dextromethorphan is a component that helps the parts of the brain that make us cough. So it works on those receptors in the brain so that we don't cough as much. So phenylephrine is another component in cough and cold medicines. It is common in things like Mucinex, Sudafed. Again, this is all for children 4 years plus. How phenylephrine works is that it helps constrict the blood vessels in the nose, so that can help alleviate the congestion. Another component is guaifenesin, also found in Mucinex, but guaifenesin is an expectorant, so this helps alleviate that chesty cough or mucousy cough. It helps break it up and push it out. So when you're looking at the 3 major components, dextromethorphan, phenylephrine, and guaifenesin, it's important to know, well, what am I trying to treat here? If your child is very stuffy and you don't want to do my honey turmeric milk for a child who's over 1 remedy, you're gonna go for the phenylephrine component, right? Because that's gonna help with the congestion more so. If your child has a stuffy or chesty cough, you're maybe gonna choose guaifenesin. If it's just more an irritating cough and a dry cough that's residual from the cold, then you're gonna choose something like a dextromethorphan. So I hope this was helpful so that when you are in the aisle for yourself or your child, you can make the best decision with all of those options out there for cough and cold medicines. So we went over why we cough, the remedies, but now it's important to know, well, when do I worry? Because I said coughs are not always a concern, but hey, sometimes they can be. The number one reason I want you to get your child checked out is that you're concerned about the cough. I say that all the time, even in my fever video, which you should check out as well, because if you're concerned about the cough, we would love to take a look at your child and say, hey, look, this looks like a common cold at this point. This is what I want you to look out for. That is the cardinal rule of parenting. You're concerned, we will take a look at your child. If your child has a persistent fever over 5 days with a cough, we obviously want to take a look at that child. Now, in those 5 days, if your child is sluggish, dehydrated, especially if they're not breathing comfortably, you need to get your child out. Please don't wait 5 days. But if your child is otherwise comfortable, hydrated, active with a fever and a cough, you can monitor. What do we want to check if your child has a fever and a cough? Many viruses can cause fever and a cough, but if your child is sluggish, if your child is having breathing difficulty or dehydrated, we want to make sure, does your child also have an ear infection? Does your child also have a pneumonia or something deeper into the chest? So look at how your child is doing. If they're not looking well to you, if they're dehydrated, if they're not breathing comfortably, please bring your child in with that cough. The other thing is if your child has thick green mucus for more than 10 days, or if your child has a fever for 3 days with green mucus. This is important because people commonly think that green mucus automatically means bacteria. Not exactly. But if it's 10 days of heavy mucus that's green, we want to make sure that that's not turning into a sinus infection. If your child has thick green mucus that is associated with high fevers, we also want to make sure that that's not a sinus infection. But just say your child has clear mucus, no fever, it turns into green for 3 days, goes back to clear. That is okay as long as you're watching out for the other things, their hydration, their breathing, what I mentioned earlier. So the last thing we're going to go over is when to bring your child in for those chronic coughs. Now, this is a difficult one because like I mentioned at the beginning, if your child has a chronic cough and you're concerned, I want you to get your child checked out. But I'm going to be going over some things to think about to say, well, is this something we can wait out? What do we need to do? The first thing to remember is that if you're concerned, you bring your child in. If you're concerned about the diagnosis, is this truly a common cold or is it allergies or asthma? You want to make sure you talk to your child's clinician. The other thing is that children can commonly get back-to-back illnesses, especially our daycare children. There are a lot of germs. Even with the best precautions, they're going to get sick. One illness can last anywhere from 7 days to a few weeks. Yes, a few weeks. Usually you get the congestion first and then you get a cough. The cough is a little worse and then it gets better. And then finally you're seeming like things are smooth sailing and then bam, you get sick again. The reason why I use the 4-week rule is that it's just nice if it's going on for a month for us to just make sure things are okay, even if your child is acting okay. This is just a personal opinion. I would want to make sure, is this allergies? Is this asthma? Do we need to add anything on? Many times when I see these families, everything seems okay. I'm not seeing anything reported that was a red flag of any kind. So when I'm looking at a kid who has a chronic cough, I'm looking at many different things. And there are some things that I want you to consider when you go to your pediatrician. How long has it been going on for? Is it affecting their sleep? Have they had any weight loss? How is their activity during the day? Are they happy, excited, and this cough is just something that they're living with? Or are they really bothered by that cough? Your child's clinician is going to check their chest with a stethoscope. They may need to do other testing if it's something concerning on the exam, but it's really important to run that by your child's clinician with the understanding that these are all checkpoints. These are all ways to know, is it something that we need to be concerned about, or are we going to continue the regimens that I mentioned in this video? I'm so happy I did this video because I think it's important to know all the different remedies by age for your child, because some things are not going to be safe for your younger child and are okay for your older child. I would love to hear your recommendations for cough and cold remedies for your child in the comment section, along with any other questions you may have. Thank you for tuning in for today's episode. If you found it helpful, please make sure to share it on any of your social media channels. Subscribe to Peds Doc Talk TV so you can stay up to date on any of my future episodes, and make sure to follow me at Peds Doc Talk on Instagram. See you next week.